parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening. Welcome to You and Your Doctor, sponsored by All County Healthcare. I am your host, Dawn Graubert. I'm excited this evening. We have Dr. Saperstein. He's going to be joining us from the hospital, so just bear with us as we get Dr. Alan Saperstein on. He is an orthopedic surgeon at Baptist Health System, so more to come with that. But last week we had a really exciting show, and I'm hoping to get more shows like that to really spotlight All County Healthcare. We had Clayton Williams joining us, and he is the Director of Community Outreach, and we spoke about all of the different offerings that All County has. And from personal knowledge and speaking that my parents used All County services, they offer everything from home health aides, from cleaning, from activities of daily living, to physical therapy, occupational therapy, anything that you can need. They'll do light cleaning. They'll even send in nurses to help with medicine disbursement. So many things that are so important that you don't understand and really know the coordination of care that you need until you need it. And as a child, when your parents get sick, no matter where you are in the country, All County Healthcare is always available online, on the phone. The coordination of care is fantastic. They work with the hospitals. They work with your physicians. They get all the orders you need. When your loved one leaves the hospital, you want to make sure that all the meds and then, of course, all the DME, all your durable medical equipment is in place when your loved one gets home. So then they can recuperate and have all the appropriate care that they need. So I'm excited this evening that we have Dr. Alan Saperstein joining us. Dr. Saperstein is a board-certified orthopedic surgeon with Baptist Health Orthopedic Care in Boca Raton, specializing in sports medicine, arthroscopic surgery, and total hip and knee replacement. He serves as the chief of orthopedic surgery at Boca Raton Regional Hospital and is a team physician at Florida Atlantic University and Lynn University, caring for both collegiate athletes and active adults. Dr. Saperstein earned his medical degree from New York University School of Medicine, where he received the Valentine Mott Medal for Excellence in Surgery. He completed his orthopedic surgery residence at NYU Medical Center, Bellevue Hospital, and a sports medicine fellowship at Lenox Hill Hospital, where he worked with the New York Jets and the New York Rangers. Practicing in South Florida, Dr. Saperstein specializes in ACL reconstruction, meniscus repair, cartilage restoration, rotator cuff repair, and joint replacement surgery. He also serves as clinical affiliate assistant professor at Florida Atlantic University, Charles E. Schmidt College of Medicine. For more information on how to reach Dr. Saperstein, you can find him at 561-955-6784 or 745 Meadows Road, Boca Raton. All right, I hope we got Dr. Saperstein. He was able to break away and join us. Thank you so much for joining us.
My pleasure. Thank you for having me, Dawn.
What a pleasure. I haven't seen, on a personal note, I haven't seen you in so many years. It's nice to connect with you.
It is good to see you. I remember those days working out in the same gym together many years. So it's good to see you. Haven't changed at all.
Well, it's good to see you. And you were always working out, an avid runner, which I guess is a great segue into healthy living and what it takes to work out. And then, of course, we'll segue into what it does to our body as we age.
Sure. Yeah, of course. I mean, on a personal note, exercise has always been super important to my lifestyle. Just staying fit so that I can, have the energy and the strength to do everything I want to do in life is very important. For me, my passion is running. I'm a distance runner, run a lot of half marathons and an occasional full marathon. But, weightlifting and just maintaining strength throughout your body is important to me as well. So really, I think it adds so much to your physical and mental health that it's really critical. It certainly is to me. And that ties into what I do, professionally as a sports medicine physician. Most of the patients I work with are athletically active. Some of them, the injuries the orthopedic problems they're having are the result of sports participation. And for many of them, the injuries that they've sustained or the conditions that they have affect the way they can participate in sports. So the two really tie in together, both the personal and the professional aspect of sports injuries.
And as we age, because you work with college athletes, and then of course you're in Boca Raton, and so you have a variety, I'm sure, of patients in different ages.
Yeah,
As
it's
we
very
age,
interesting. I
right?
mean,
Yeah.
yeah, the contrast is really remarkable. I mean, I run an orthopedic sports medicine clinic at Florida Atlantic University in the mornings, and I'll go there and see these 18 to 24-year-old athletes, and then I'll go to my office and see 80-year-old athletes. So it's there's quite the contrast. There's some overlap in the conditions that they each may have, but there's also a lot of differences in the types of injuries that you sustain at 20 years old and at 70 years old. So there is quite a contrast as well.
What are the things you look at? I want to say in return to play, but even before we get to that point, what are some of the issues and the warning signs for an athlete to come see you versus just, oh, let's wrap it up and put an ice pack on it?
So, it's interesting. Most people intuitively have a pretty good sense of when an injury is bad enough that it requires medical attention. Um, when you twist a joint, a knee, an ankle, and you can't put weight on it, it hurts so badly that you can't walk on it. You need crutches. That's usually a good sign that, hey, I think this may need to be looked at. Also, when an injury lingers, maybe there's a pain that's not so severe, and you can tough it out a little bit, but it's really not getting better, and a week or so goes by, and you're just not seeing any improvement. That's kind of a sign that maybe it's time for some medical attention. And of course, the severity of the symptoms. If there's a lot of pain, if the joint, the knee feels unstable, where it's buckling, that's another sign that maybe it's time for some medical attention. But I think most people have a pretty good sense of it. They know when it's time to get looked at.
I don't know. I think sometimes when you're an athlete, you push it. Like, look what Lindsey Vaughn, unfortunately. You push it because you think you're superhuman and we can do these things. College athletes probably do it even far more than at our age we do.
Yeah, the nice thing for the college athletes is, while I'm a team physician at FAU and Lynn University, and I help take care of these kids, they have athletic trainers who are with them for every practice, every competition that they're at. So their first contact is the athletic trainer. And these are really very skilled professionals who know quite a bit about musculoskeletal pathology and how to manage injuries. And they are really the they are really the gatekeeper from the patient to me. They're the person who decides really, hey, it's time you get looked at. So I think these people serve a critical role, and they really help the athletes know when it's time to okay, take it easy a little bit. Let's see the doctor, and let's see if there really is something here that needs a little further attention.
And then you've got the scope of Boca, right? We've got our weekend warriors. I remember back in the day, my husband used to play full court basketball, and then he went to half court basketball. Then he blew out a few Achilles, and that was the end of basketball. I think as we age, we need to get a little more comfortable with, I don't want to say limitations, but the changes we need to make to accommodate our bodies.
Yeah,
What do you
I think
suggest?
that is important. I mean, I think it's also important not to give up. I think we all, I think some of the happiest people I know are the people who are still actively engaged in the sport of their choice into their 80s and potentially even beyond. But you're right, there are modifications you make. If you're a tennis player, maybe it's time to go from singles to doubles. As a runner, years ago, I realized it was time to go from marathon to half marathon and just calm it down a little bit. So yeah, there are some modifications, and you can't expect to be as fast and as sharp as you were once. But if you keep at it, I think you can maintain quite a bit of what you once had. And I think it's important to have that attitude. Yes, I'm going to keep doing this. And really, I think my patient population reflects that. I think that a lot of my patients are really looking to remain very active, and if they do have to make some modifications, they do what they have to do to stay in the game. I think that's so many athletes now have gone from tennis to pickleball. Similar skills in terms of the upper hand-eye coordination, upper extremity skills, but a little less running around. So potentially a little bit easier on the lower extremities.
And once we get past conservative care, I'm sure your office in Baptist has a lot of conservative care. You've got physical therapy, different modalities to help out. If conservative care doesn't work to a certain point, you can operate. We're looking at you do meniscus tears, you do ACL repairs.
Yeah, so I'm a sports medicine trained physician, orthopedic surgeon. So a lot of what we do is in sports medicine is arthroscopic surgery, which is surgery that's done without a full exposure of a joint. It's basically making small incisions into the joint and putting a little camera basically into the joint where we can see everything inside the joint, most commonly the knee, but frequently the shoulder and other joints. And then we can repair things. Initially, when arthroscopy came out, it was really just a diagnostic tool. We looked around and we saw what was wrong, and hey, that was great, but we couldn't do much. But it's really evolved over the past 40 to 50 years, and now we can repair quite a bit of pathology in a minimally invasive manner. And obviously that's tissue sparing, so there's less pain or pain for a shorter period of time. People start moving their joints faster. They can regain strength faster by doing surgery in a less invasive manner. Now, of course, there are certain things that we can't do arthroscopically. When it comes down to joint replacement surgery, so when arthroscopic techniques to repair the joint really haven't worked, then the fallback position is resurfacing a joint, and that's joint replacement, knee, shoulder, hip, and others. And that does require an open approach, but we've gotten more skilled over the years at doing those surgeries in a manner that allow for a quicker recovery and less pain and less disability.
Are most of these procedures done outpatient, or some of them still require overnight admission?
There's been a tremendous shift in orthopedics in the last 10, 15 years to move things to outpatient. And I would say the vast majority of the surgeries I'm doing now are outpatient surgeries. There's still occasional procedures that we'll do with a hospitalization, usually a one-night hospitalization. We're not keeping people terribly long. And most of the time that's because patients have medical comorbidities that really just need to be watched overnight after exposure to anesthesia. But almost every procedure has the potential to be done as an outpatient these days. And a big reason for that is the anesthetics. Now the anesthesiologists are doing nerve blocks for pain control after surgery. So patients can leave the hospital, leave the outpatient surgery center the day of surgery and go home pretty much pain-free in most cases, which is just fantastic because people recover better at home. They're more comfortable at home. They're around loved ones. Everything is just the way they like it at home, and people are just happier that way. It leads to better results.
Incredible. All right, hold that thought. We're going to take a quick commercial break. When we come back, we've got more questions and answers with Dr. Alan Saperstein. If you want to call into the show, you can reach us right here at the studio at 888-994-4995, Studio A. We can ask Dr. Saperstein a question live on South Florida Oldies. More to come with You and Your Doctor, sponsored by All County Healthcare, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. All County Healthcare is a Medicare certified home health agency working within Dade, Broward, and Palm Beach County. You can reach them at 954-717-7027 or info@allcountyhealthcare.com. This evening, we are very happy to be talking to Dr. Alan Saperstein, who is orthopedic surgeon at Baptist Health Center. You can reach Dr. Saperstein directly at 561-955-6784. All right, let's bring Dr. Saperstein back over. All right, you work with Baptist Healthcare and
Yes.
Baptist Hospital. Tell us the benefits of working within a large hospital organization.
So I'll preface that by saying for much of my career, I worked in a private orthopedic group before coming over to become a Baptist physician about 7 years ago. And that was right around the time where Baptist became the manager of Boca Raton Regional Hospital. And I will say, since that transition has occurred both for me and for the hospital, I've really seen some wonderful changes. I've seen expansion in the facilities that are available to us. Was it 2 years ago, we opened a building that's predominantly dedicated to orthopedic surgery. It includes the orthopedic surgeon's offices, includes an outpatient surgery center with 5 operating rooms. That is not entirely orthopedics, but to a large part, for a large part orthopedics. And really, it's allowed for integration of the orthopedic surgeons with the rest of the medical community. It allows us to, being part of this organization, allows us to have strong relationships with other specialties so we can refer patients back and forth as needed. It allows us to create a larger orthopedic group with multiple subspecialties. And same concept, that a lot of times I see patients predominantly for shoulder, hip, and knee problems. But sometimes a patient comes in who has a foot and ankle problem. Well, I have a partner who specializes in foot and ankle. I can send them to him. Same holds true for wrist and hand problems and other subspecialties within orthopedics. The equipment that has been available to us, because Baptist really has such great resources, has been wonderful. We started a robotics program at the hospital and at the outpatient surgery center 3 years ago, I want to say. And that's really revolutionized how we're treating joint replacement patients. And I know certainly it's been something that I've been happy to be part of on a personal basis. Baptist has other resources. Not all of them are in our building, but we have physical therapy in a facility that's basically around the corner from where we are. We have about 4 MRI facilities within a quarter mile of my office. So it's really just nice to be able to have everything available to us on an as-needed basis, usually with pretty good access for us and for our patients.
We've been practicing in South Florida a long time. I've known you a long time in the medical community. The way medicine has changed, you feel it's changing for the better, for the overall patient outcomes?
I believe so. I think there's more of a focus on patient outcomes now than there was previously. I think early on when I started practice, we didn't really think so much about patient satisfaction scores. We didn't have patients doing questionnaires about satisfaction. We didn't do patient-reported outcomes of interventions. Now there's a very strong emphasis on that. We're following up with our patients to find out, number one, how happy they are with the services we're provided, and also how happy they are with the results of their treatment. And that was unheard of 20, 25 years ago. So I think that does lead, and I think that allows us to make changes that improve patient outcomes. I think there's more of an emphasis on medically proven
I think we,
interventions because that's how they were done. Now I think it's more evidence-based practices. I think the hospital guides a lot of those practices. Our practice guides a lot of those practices. We do operate along certain guidelines. It doesn't change the fact that physician judgment and intuition is still an important part of practice. But I think there is more science, there is more hard data that we're basing our practices on now than we were, say, 25 years ago.
what do you think patients are looking for now? And I don't even want to say it's back to life as it was, because I think patients probably always wanted to get back to life as it was. So what are you seeing in patient satisfaction that's changed? Is it that we're actually asking, or is it something else?
Yeah, so we're focusing on patient satisfaction. I can't tell you if that really came more from the industry or from patient demands or a combination of the two. But certainly practice nowadays, medical practice nowadays, and it's not just us, I think this is going on all across the country, is really focused on the patient and how they perceive their care and what their result is. Whereas I don't think it was like that in the past. I like to think that we've been proactive and pushing forward with that agenda. But I think if you're not proactive and working towards patient satisfaction gains, I think you're going to get left behind. So I think we sort of have to do that, but we want to do that. We want our patients to be happy and to feel better.
And after a procedure, patients go home for recovery. Sometimes they need home health care, whether they
Absolutely.
need it short-term or long-term. What are some of the types of therapies or home health care that you might recommend or you might prescribe?
Yeah, let me preface this by saying, we talked about how surgery has moved from the inpatient setting to an outpatient setting, but also the post-surgical, the post-hospital surgical setting has changed as well. Again, if we went back 20 years, we would find that most patients after a joint replacement would go to some type of facility, a rehabilitation facility, to start walking again. Those days are pretty much gone. And there are still some exceptions, particularly elderly patients, but for the average patient going in to have an elective joint replacement surgery, a hip or a knee, whether they do it outpatient or stay a night in the hospital, they're going to go home. And when they do go home, they're going to need services. First and foremost, they're going to need physical therapy. I mean, that really, from my perspective, that's what we need home health to do. And the goals are basically to get the patient up and moving. Now, many patients will take the initiative to do a lot of that on their own or with the help of family members, but having a skilled professional come in and provide physical therapy to give them the confidence to get up and start walking and to assist them with that is really invaluable. And the vast majority of at least joint replacement patients will require home health predominantly for that purpose. There are other services that occasionally we'll utilize for home health, whether it's medication delivery or monitoring of blood tests. So there are other services, administration of antibiotics or other medications from time to time. But for us, 95% of what home health is home physical therapy.
It's interesting to see how healthcare has shifted, because before you would do a procedure and you would stay in the hospital whether you had a comorbidity or not. but you would have more medical management, you would have more pain management, you would get up and walking around with some hospital PT. Now it's great the patient says, yes, great, I want to go home, but it doesn't mitigate that they're still going to be uncomfortable, they're still going to need help and still need services. So it shifted. The continuum of care now goes from the hospital now to you ordering it for home-based care.
Yeah, no, absolutely. Again, the one thing we don't want our patients to do is have surgery and then go home and lie in bed. So we do feel very strongly that certainly the vast majority of patients who are having a joint replacement or other surgery of a similar magnitude would need home health to get them up and get them moving. And again, give them the confidence to work on movement and on their own as well. So yeah, it is an invaluable piece of the puzzle.
All right. Fun fact about you, Dr. Saperstein.
A fun fact about me. So, I have a dog. He's a Maltipoo, and he secretly wants to take over the world. It's actually not so secret.
As he should, right? It's a dog's world.
He has plans on becoming the supreme leader of the world. So watch out for him if you run across him on the street.
Thank you so much for joining us. It's such a pleasure to speak with you.
Pleasure was all mine, Dawn. Thank you.
Have a great evening. For more information, you can reach Dr. Saperstein to schedule an appointment or more information on his practice. You can reach him at 561-955-6784, and his practice is located at the Baptist Healthcare System right here in Boca Raton. And for more information on All County Healthcare, you can reach them at 954-717-7027 or info@allcountyhealthcare.com. Happy Thursday, everyone. Have a great evening, and until next time, we'll see you then.